Welcome back from the break. Thank you so much for staying on the show with us today. As you know, we are talking about heart matters and being heart-wise. We have a guest in the studio with us today, Dr. Asma Faisal. She's heading the MBA Health Management Department at CBM, Slalikom. Dr. Faisal, thank you so much for taking the time out to talk to us. We were talking before we started recording the show, and you brought up a very interesting point. You said that how come being a doctor, you still like being called like a health manager. So can you tell us a little bit about what health management is about?
Sure, why not? Actually, health management is a relatively new concept in Pakistan, although it's quite common in the Western countries and in the Western culture, but it's relatively new, but although it's on the rise. This health manager is basically a doctor or a health professional like a dentist or any other health professional, but he should have a management background, both academically and professionally. Like he should have a management degree, proper degree, and then he should have worked on an administrative position in any healthcare organization. So he should have a medical background, administrative background, and the educational background related to the so he has to do a proper full degree like MBA in management, but health management sciences.
Health management.
So it's a dual degree manager, and quite elite socket fixed managers, because if they are taken in the market rightly as they are worth, they can really create wonders.
So what does a health manager do?
There are finance managers, there are marketing managers, there are HR managers. Then why not health managers? They are, because any organization, when it needs to have figures in front of it, like increased profitability, less turnover. Health organizations are huge, big organizations. And these are one of those organizations which are not affected by even the economic meltdown also. So they are highly profitable and a big, huge industry. And this is a misconcept that being a wonderful physician and being a good practicing physician, you can be a wonderful administrator of the same place. Not at all. This is a wrong concept. Totally wrong concept. In Pakistan, this is a dilemma that whoever has got huge practice, physician or the big names of the surgeons, they are the administrators of the hospital. Both the jobs are compromised. So health managers, like any CEO of the hospital, any administrative responsibility, what a manager should do, they should have a management background. Even in pharmaceutical industry, just take a example of pharmaceutical industry. Before 5-6 years back, they used to take MBAs, and they used to take only the managers with management background. But now they have realized that convincing the doctors to prescribe something for them in order to increase the profitability and to meet the objectives, what actually they do now, they want doctors plus health managers who have the management background. Because a doctor knows better how to convince a doctor, how to enter into an industry, how to find the ways out. So health managers requirement in the pharmaceutical industry is on the rise.
When we're talking about individuals, imagine you are a health manager you are a health manager and you are working in a corporation, regardless of whether it's a pharmaceutical or it is a hospital or it is a multinational or an NGO, wherever. How do you prescribe to people to live healthy lives? If we are talking about a healthy heart, then how is it important to create a healthy environment within the company? I presume that is the first step.
Exactly. Now, in perspective of that topic, I would like to emphasize here the importance of health management sciences in any organization. You just name it. Name any oil industry. If in any big organization you have doctors, you have sometimes you have doctors to deal with the emergencies. But if you have health manager, he deals with the strategies. He deals with the policies, like health promoting culture, like preventing health strategies in an organization, like smoke-free environment. This is the employers, from the employer's perspective, and what employers do, they actually consult the health managers that what we should do to promote and the preventive health culture.
Healthy environment.
So they like provision of the good food and the healthy food and the choice of the healthy food, the supervised kitchen facilities, and to provision of the gym and provision of the information leaflets. This is what health managers do. They give information about the calories calorie intake, all the time banging, a little leaflets, just throw on the desks of the employees, and, they'll create wonders. And promoting the health culture, and, promoting health culture, healthier employees, healthier corporations, high profitability, less turnover, decreased absenteeism, blah, blah, blah. And then again,
if you are a health manager within a multinational, for example, or an office, you would recommend that you would pass out leaflets to people that this is a healthier way of living. You would ensure that there are smoke-free zones, or if there is a smoking area, it is very separate from the rest of the office. You would ensure that the canteen is serving decent calorie counted food, or just you have options. You have good options. You don't just have burgers or fries and things like that, or biryani. You would also encourage people to climb stairs rather than take the lift. Are those some of the things that are important for a healthy heart?
Exactly. One of the studies conducted at some big, huge organization abroad says that those people basically after the lunch hours, they are productive. Their
productivity goes down.
Goes down to 50%. But those who take only 30 minutes of exercise in that lunch hour, or just breathing exercise, or just relaxing exercise. All these things are the responsibility of a health manager, or any employer's responsibility to provide the workshops and to provide the opportunities to take part in the corporate health programs. There are so many consultant health organizations who arrange the corporate health programs and workshops and relaxing exercise, stretching exercise. How to you just sit in the office on your keyboard and you can still have stress releasing exercises, because stress is again the main cause of the heart disease.
There are some businesses, or there are certain most businesses, I would say now, Dr. Faisal, that have very stressful environments and very goal oriented environments, in which you don't have the time, like even lunch is on the go. They have their sandwich on the table because they have deadlines, they have presentations. How do you then change? Do you need to change the actual culture of the entire company?
Exactly, but total change of the culture, because when this is actually management by objective. I would like to emphasize here management by objective. When the employees and the employers sit together and then they identify the areas, they sit together, they decide what are their problems, actually what problems are stressful for them, and then they decide their goals. This is actually a cultural change. Employers should identify the problems which actually the employees are facing, and this is a new concept. In Pakistan, it's a new concept, but it's it's written in every management book. Management by objectives. Every employee should be a part of the goal setting exercise. They should know what they have to do. They'll be happy in achieving those goals and those objectives. And then they'll be happy employees, and then they'll have less stresses, because duplication of jobs and unity of command. There's so many problems. Management should recognize these little things, and health managers really help in sorting them out. Every organization should provide the facilities, a little bit of facility like gym. I'll cite an example of my own organization in which I'm working. It has got state-of-the-art gym, and it has got wonderful cafeteria with lots and lots of choice of food, and it has got totally smoke-free building. It's a huge big building. If you want to smoke, you have to go out on the Korangi Road, go out, and within the sit between the bus drivers and then smoke.
So it's discouraging smoking.
It's so discouraging, and so this is the kind of culture that should be promoted from the employer's perspective. And the employees should know their blood cholesterol. They should get their things checked up and after 40 at least, you should have your corporate health checkups done every year. And if there is risk factor, you're smoking also, and you're obese also, your anterior posterior diameter is increased, then you have to get it done every 6 months.
6 months. How important are holidays? To take time off?
Highly important, because of release of stress, because all the excessive stress hormones which are accumulating because of the there are kind of jobs in which you work in the fields and far-flung fields for 15 days, and then you in Western culture, then you have 15 days off in order to replenish all the stress hormones, and so we should take good lessons from the Western environment, which Western health promoting culture. They are really working hard on health promoting cultures, and now it's actually employee has taken it as a right. Previously, they considered it was a privilege to get the health facility from the organization, but now it's the right. So when it's the right, you are in a competitive environment. So being competitive, being profitable, you have to have innovative strategies all the time being implemented in your organization in order to make your employees healthy and happy.
Well, that's a great note to end the interview on as well. Thank you, Dr. Faisal. That was fun.
Thanks a lot.
We're going to go on a very short break. Please don't go too far and join us again after the break.